Good morning, everybody. Thank you so much for joining us today. This is probably our second webinar that we've been doing in 2025, and we are going to bring you kind of a bunch rapid speed here, starting out with UHC and AARP MedSup. So we do have Claire Hughes here today. She's been with UHC for a very long time, and she is extravagant in the amount of information that she has on MedSup and their ancillary products. So you're in for a real treat today. All the webinars that we're doing are recorded. You can find them on our training library on our website. You have the ability to interact with us today. If you check on the bottom right of your screen, there's a chat box that should open up. There's a group chat. There is a section for question and answer. So go ahead and write your questions in there, and we'll be sure to get to them before the webinar is over today. There's a place for handouts as well to reference back to, and that's about it. We're excited that you're here, learn about MedSup, ancillary, some agent portal stuff, and thanks for joining us. I'll turn it over to you, Claire.
Thanks so much, Christy. Good morning, everybody. Thanks for being here on this cold Tuesday morning. It's kind of like a Monday, I think, with many of us off for the holiday yesterday. So as Christy said, I'm going to give you, I'll say an overview of the AARP Medicare Supplement Plans, talk a little bit about the product, some of the resources as well. And I got a lot to cover. So if I go too fast, feel free to stop me along the way if you need me to go over anything. But the good news is the information we're sharing with you today is available to you across our different resources. So it's not anything you have to commit to your memory. We do have a lot of good resources for you to find. Just a quick introduction. I apologize for not being on camera, a little bit of a technical difficulty this morning on a couple things, including the camera. But that's me on the left. I am one of the regional growth directors for the AARP Medicare Supplement Plans. As Christy said, I've been around for quite a bit of time. Later this year, I'll celebrate 25 years at United Healthcare, pretty much all on the AARP Medicare Supplement Program. I am regionally set up, so I cover 9 different states, meaning I'm responsible for the MedSup product in those 9 states. The big one, obviously, Pennsylvania, that is my home state as well. Different states all the way down the coast. As you see outlined there. I do have a colleague, Karen Goodmote. From time to time, you may be in touch with Karen, whether or not you've brought in maybe an escalation our way, and Karen has done the research to get that resolved for you. She also assists me on some webinars and trainings as well. She is, I'll say, my right-hand person. She is amazing. When you talk about a wealth of knowledge, Karen is super knowledgeable. So I'd just like to give her a shout out so you're familiar with her name as well. Before we jump in, I just wanted to do sort of a little commercial here, a little advertisement for an incentive we currently have underway. The sub sales, it launched back in November of last year. So during the middle of AEP, we were able to get approval to get this incentive underway. And it's an application bonus for certain MedSup sales. So it's going to apply to underwritten sales of Plan G and Plan F that were written between November 5th and up through a signature date of February 28th for effective dates of December 1st, January 1st, February 1st, and March 1st. You need a minimum of 3 sales to be eligible for the promotion, but there's no limit to how much you can earn. So it's $150 per app, underwritten apps during this time period for plan sales of Plan G and Plan F. And you'll see it's limited to about 12 states. Pennsylvania is one of those states. I'll shout out West Virginia as well, and Ohio, since some of you may be selling over state lines, but you'll see there on the screen the list of the 12 states. Hopefully you've seen communications about it, but I do like to bring it up. Great opportunity to earn some extra cash during OEP. So just a little bit about what we talk about here. This is sort of a set agenda, but it's not necessarily, how we'll go along. A little bit about UHC, what makes the AARP Medicare Supplement Plan stand out in the market. I'm going to hit on some of the key features of underwriting, eligibility, and rating. They are essential components to the program or to enrolling a client in the plan, so hopefully share some tips and tricks with you around that. Talk about the process of going through the enrollment and the resources, and also share with you some helpful resources for both you as an agent and your clients as well. So a lot of good information to come. Oops. So we talk about why UHC. A couple things that stand out when it comes to the value proposition. First and foremost, when we think about the brand, often when I'm speaking with agents, they say, oh, my clients talk about that AARP branded product. They want that AARP product. So the AARP brand does bring some great recognition to the plans that we have to offer. We are the only Medicare supplement carrier that has the distinction of having the AARP brand on our products. As you probably know, Med-Sup plans are standardized. So we have to look for ways to differentiate ourselves in the market to stand out among the consumers as their plan of choice. We offer a variety of different discounts and services along with our program to make sure that our plans are accessible and as affordable to as many individuals as possible. We know how important your role is in the selling process, so making that experience a simple and easy one by providing you access to tools and resources is at the forefront of the work that we do. A lot of our success has been based on being able to deliver best-in-class products and services to consumers. In fact, our satisfaction rate stands at 95%, and our persistency is averaging 10 or more years. What's nice about that, when you think about persistency, your clients are likely to stay on the books. That provides stability for you as an agent in your book of business and allows you that time to go and get new clients and grow your business. And as you probably know, Med-Sup plans are guaranteed renewable. That means that a member does not need to sign up year over year. And with standardized benefits, there's not a lot of things changing. Again, that provides that stability and that consistency in your book of business. When we look at the market share, this is actually one of my favorite things to talk about. When we look at the market share of the AARP Medicare Supplement Program, over 30% of the Medicare insured members in the industry have an AARP Medicare Supplement plan. That's a pretty phenomenal statistic. In fact, if you look at the other slices of that pie, we are 3 times the size of the next leading carrier. And when you add up carriers 2, 3, 4, and 5, their total combined market share does not equal the market share of the AARP Medicare Supplement Plan. That brings along a great message of consistency, stability, and satisfaction, knowing that we have the privilege of serving over 4 million Medicare Supplement members nationwide. So when your clients are looking for that, who's the market leader, this is an important statistic. In fact, we have a lot of statistical information. I'm sure you probably can't read that fine print at the bottom, but in your producer handbook, we actually have the address where you can find statistics like this on a public website. And I can certainly do a follow-up to you, Christy, as well, if you'd like to share it. It's www.uhcmedsupstats.com. And again, it is noted in the footnotes in your producer handbook. And that's where we publish statistics like this so that you can have access to them for talking points when meeting with your clients. So when we talk about our offerings, what are some of the key elements of a Medicare supplement plan that would resonate with the consumer? One is that they want a plan that fits their budget and lifestyle, right? What does that mean? Not all plans are the same. Not all people are the same. So having a choice of plans for the members that choose to find the plan that best meets their personal needs provides that flexibility and choice to the consumers. A plan that fits their budget allows them to choose more, make more decisions around their healthcare. They choose not only where to get their healthcare, but they can choose when to get their treatment. There are no networks and no referrals needed. Members can decide when to get that healthcare, and they can go anywhere in the United States as long as the provider accepts original Medicare. So as consumers are looking for that flexibility, they maybe don't want to be locked into a particular network. This could be a key reason why they would choose a Medicare supplement plan. And with the benefits being standardized and the benefits remain generally consistent year over year, the plans are guaranteed renewable. So members stay insured in the plan for a long time. They don't need to go back and change each year due to changing benefits. So that gives you, again, the ability and the freedom to find new clients, knowing that the clients you have insured in our AARP Medicare supplement plans are satisfied with the plans that they have. Some of the basic guidelines. So when it comes to enrolling, a couple things do need to come into play. Based on the program that we have, AARP membership is required for the consumer to enroll in the plan. Now, AARP memberships do cover 2 individuals in a household, so the enrolling member could be either the primary or the secondary on that AARP membership. It could be a husband and wife, it could be domestic partners, it could be 2 individuals living in the same household that have decided to share an AARP membership. They just need to be on that account so that membership is valid when they go to enroll in the plan. Parts A and B do need to be active at the time their Med Sub plan is scheduled to begin. And why do I say it like that? From time to time, we'll have some outreaches from agents in a paddock saying, I'm doing the application, and it's asking me if A and B are active. They may not be active today. Maybe it's somebody aging into Medicare, but will it be active at the time their coverage goes into effect? Think of the question in terms of that. They do need to be a resident of the state in which they're applying. In society today, there's many consumers fortunate to have maybe a second home. They should be using what they deem to be their legal residence for the state in which they're applying. Generally, the plans do apply to consumers who are 65 and older, but there are a number of states where we do have coverage available to consumers under age 65. Pennsylvania is one of those states, for example. Your producer handbook is a great resource for any state-specific information, such as under 65 coverage, to determine what the eligibility requirements are and what plans may be available. Please know that under 65 coverage does vary from state to state due to state regulations, so it's important to refer to the resources for all of that detail. When we talk about our offering, we sure love our maps, but they do provide a great visual overview of the plans that are available. So if you're looking at this map, you'll see the states highlighted with the navy blue coloring represent the states where we have our standard plan or our legacy plans. And we call those affectionately UHIC because these plans are insured by United Healthcare Insurance Company. These are the plans that have been in market for many years, and they are the ones that offer the wellness extras, most notably the Renew Active Gym membership. But as things have changed, when we had since our plans were in the market, a few years back, we opened up a new license and decided to open up a new set of plans in market alongside our UHIC plans. Opening a new set of plans required us to open up a new entity for those plans as they are filed differently from our existing plans. Those are the states you see highlighted in the white and that light blue color for North Dakota. And these plans are known as UHICA. And that is because the entity under which these are opened is United Healthcare Insurance Company of America. Both are AARP branded, but offer different types of features, which I'll share with you in just a moment. And then New York has its own color. New York has our UHIC plans, but the entity under which those plans are offered is unique to New York, and that is United Healthcare Insurance Company of New York. So those white states, before I forget, those states indicate where we have both UHICA and UHIC in the market. So UHICA was not designed to replace UHIC. It was designed to complement with a different set of features. North Dakota is that lone state where we do have just our UHICA offering in place. We talk about our plans. This is a snapshot. I like to call it a little cheat sheet of the overview of the key benefits coming under the lettered plans. You do have resources like this both in the enrollment booklet, which is a tool you can use to educate consumers about the AARP Medicare supplement plans. You also have an image in your producer handbook, which is an agent-specific resource. And we do have maps like this in our various marketing pieces as well. This gives you a high-level overview of the benefits of each of the different lettered plans. And as you can see by the check marks, some plans cover more than others. Currently, Plan G is the most comprehensive plan available to newly eligible consumers. It is our most popular plan today. Plan N is also Another important plan where we see a lot of activity, particularly in states like Pennsylvania, where we do not have excess charges on our Part B services. But there's other choices as well. Plan K and L offer cost-sharing plans. What that means is when the consumer enrolls in a Plan K or L, as you can see by the percentages there, the MedSup plan will pay a portion of the 20% not covered under original Medicare, and the consumer would pay a portion up until the consumer has met an out-of-pocket max. Those out-of-pocket maxes are indexed each year. And as you can see below, we do have the 2025 updates now part of our materials. From a UHICA perspective, the plans are the same in terms of benefits, but in our UHICA offering, we offer fewer plans. A, F, G, and N are the core UHICA plans you'll find in most states. But in the state of Pennsylvania, which I've highlighted here, we do offer Plan B as part of our UHICA offering. That is a state requirement. So if you were to look at another UHICA state, you may not see Plan B offered. But in some certain states, such as North Carolina, you will see nuances such as a Plan D offered. Again, another reason, if you do sell across multiple states, always refer to your resources to ensure you have the specific information for that particular state. I love these charts. I actually keep a copy on my wall because it's a quick at a glance when someone might call me with a question. And these are meant to provide that great guidance to you. When we talked about the UHIC plans, one of the key differences between UHIC and UHICA is the wellness extras. These are add-on services that are available to members who are enrolled in a UHIC plan. These services are not offered under UHICA. Okay, so one of the big differences there. And as you can see, it's color-coded in terms of which services are available based on states. But the full list of services available include our Renew Active, AARP Staying Sharp. We have hearing, dental, and vision discount programs. This is not to be confused with our new standalone DVH product. These are simply discounts that insured members can access if they use participating providers in those services. So it's a discount program part of the UHIC offering. They also have access to the AARP Smart Driver course, as well as our nurse line. So a lot of good extras, if you will, under our UHIC offering. One of the key decisions between a consumer choosing UHIC for UHICA versus UHICA would be if they were interested in that gym membership that comes under UHIC. Speaking of that gym membership, Renew Active is a very popular resource for our members who like to stay active and visit participating facilities. There were some changes at the end of the year on our Medicare Advantage side, with some of the networks being simply core. I just wanted to reiterate that for AARP Medicare supplement plans, the premium gyms are still being offered. So for Medicare supplement members, they still can access the premium gyms available. Now, they may not see them on the Renew Active site when you go out to uhcrenewactive.com. But if you have questions about a premium gym and you want to verify it for your client, you can simply call the producer help desk. They have a full list of the premium gyms available and can answer questions for you. Your clients or insured members can see the premium gyms if they go to their member portal. If they set up a member portal, when they log in under their own ID, they will be able to see premium gyms as well. We are working with Renew Active to get the premium gyms set back up on the website for MedSup and for those areas where the premium gyms are still available. Hope to have that back up and running shortly, but in the meantime, that's our little workaround if you have questions when you don't see premium gyms out there. One of the ancillaries that Christy alluded to is our standalone United Healthcare dental, vision, and hearing plans. These are a pretty new benefit that are now offered a great opportunity to sell this plan alongside an AARP Medicare supplement plan. Because as you know, original Medicare does not cover routine hearing, dental, and vision care needs, but many of your clients may be looking for those types of benefits. If you are authorized to offer the MedSup plans, you can sell the standalone DVH product. It's a separate plan. It has separate commissions, which you can find by viewing your commission statement or your commission addendums in Circon. There's a separate amendment for the DVH plans as well. We launched these a little over a year ago. The takeoff has been pretty good. We continue to see growth month over month in this plan. The new DVH plans are a bundled plan. So the dental, vision, and hearing components all come together in one plan. They can be sold separately. So if you have an existing client, perhaps in an AARP Medicare supplement plan, who enrolled before the DVH plans were offered, you can go back in and do that enrollment. And today, in fact, if you have somebody who doesn't even have a plan with us, you can do that enrollment. Now, the enrollment is strictly online. You have to use Jarvis Enroll. And you would use the MedSup component of Jarvis Enroll to do that enrollment. It's pretty straightforward and a simple process. Some of the key features that you will see is that there are no waiting periods for preventive, basic, and most of the major dental services. And when I say most, it's simply the implant benefit that's available with the highest level coverage that has a 12-month waiting period. All other services are available the day that the coverage goes into effect. So as we began rolling these out, we're currently in about 24 states. I've got Pennsylvania highlighted, figuring most of our audience today would be Pennsylvania. But you see there the list of the other states where the plans are available. If you are licensed and appointed to sell the MedSup plans in any of those states, you would be able to sell the DVH products in those states. And they are portable. So if your client were to purchase a plan and move to a state where we don't yet have the DVH plans offered, the plan does move with them. So they wouldn't lose the coverage if they left and moved to another state. And one of the nice things about these plans is that we built this set of plans to be exclusively sold by agents like you. If a member were to call telesales and ask about this plan, they would not be able to insure them or enroll them in this plan. It can only be sold exclusively by our agents. So a nice little feature as well. We do have a lot of information out on Learning Lab around these products. You can also access it from the Knowledge Center section on Jarvis as well, where you can see premium information. We have a fantastic brochure that looks just like a PowerPoint presentation you can use to educate your clients, as well as the ability to look up the providers in all 3 different networks for the dental, hearing, and vision. One quick shout out, just in case anybody does sell across state lines in Ohio. We do have the product available in Ohio, but it is only the dental and vision. The hearing benefit is not available in Ohio. So just wanted to make that mention for you. So as we advance through the product itself, and we think about how does a person enroll, there are 3 key scenarios the consumer may be in when it comes time to enroll. They could be in their MedSup open enrollment. They may have a guaranteed issue right to come into the plan, or it may just be a voluntary move and they'll go through underwriting to determine their eligibility for coverage. MedSup open enrollment refers to the first 6 months the consumer enrolls in Part B. That can be when they turn 65, or maybe they had credible coverage through an employer and they delayed enrolling in Part B. And now it's time for them to leave that employer coverage and they're signing up for Part B. They have a 6-month enrollment window from the time that Part B coverage goes into effect. And if it's a consumer who is eligible for Medicare prior to turning 65, when that individual turns 65, they do have a new 6-month enrollment window to come into the plan. So we call this MedSup open enrollment because it is specific to their initial, we call it initial enrollment, if you will, into Medicare. But we know we have a lot of enrollment periods out there with all different rules. So for MedSup, we call it the MedSup open enrollment. And why is this a good time to come in? When a person is in their MedSup open enrollment window, they can get a choice of any plan for which they're eligible. And why do we say that? If you remember back in 2020, legislation was implemented on January 1st of 2020 that restricted access to plans F and C to newly eligible consumers. So a consumer enrolling today, unless their Part A is prior to January 1st, 2020, they would not have access to Plan C and F. There is no underwriting, so you would skip over those questions. If you use Jarvis Enroll, those questions wouldn't even appear. And there's no waiting period if they have a pre-existing condition. Okay. Again, remember, we're not asking any medical questions through underwriting for a consumer in this situation. So it's going to be something that you would probably see a pretty instant approval on if you're using Jarvis Enroll. Another scenario could be somebody who is eligible for guaranteed issue. Now, guaranteed issue is sometimes used interchangeably with MedSup open enrollment. Both scenarios do involve guaranteed acceptance, meaning no underwriting, but they are two distinct events because of the rules associated with them. So guaranteed issue is when a certain situation has occurred and it gives the consumer access to certain plans. Remember on that prior slide, under MedSup open enrollment, they could have any plan for which they're eligible. But under guaranteed issue, carriers are required to offer certain plans. The consumer does need to meet one of the guaranteed issue rights, which we've clearly outlined in our producer handbook. We have a fantastic chart that describes the scenario, lists out which plans are available based on the consumer's Part A date. And then there's a column there that explains what documentation is needed. And that's an important component of getting the application processed and approved under guaranteed issue, is the validation that they do meet the criteria for guaranteed issue. So that documentation will hold up. If it's not submitted, it will hold up the processing and the application. So it is an important component. Another difference with guaranteed issue is that the time period for action is shorter. The consumer has, in most states, 63 days to enroll in a plan using the guaranteed issue right. So some specifics around there for guaranteed issue, but the consumer would still not go through underwriting. And again, there would be no waiting period if they had a pre-existing condition. This is an overview of the chart that you'll find in the producer handbook. I actually do a webinar on rating, eligibility, and underwriting, and I go through them in more detail, but I just wanted to let you know where the resources are. You'll find it a very helpful chart to explain each of the guaranteed issue rights for a particular state, and they can vary as well. And then finally, if your client is not eligible for guaranteed acceptance, so that means they're not in their MedSup open enrollment period and they do not have a guaranteed issue right, they can still come into the plan but their application will be underwritten. We're going to use underwriting to determine eligibility. Can we issue coverage? And we're going to use answers to certain medical questions to determine the rate that will be applied to that consumer. If you're looking to get familiar with the underwriting questions, we have a couple of neat opportunities. On the left-hand side is just an illustration of our test site. Out on Knowledge Center, you see the path there. We actually have a test site that mimics Jarvis Enroll, a great tool for you to use to practice if you're not comfortable using Jarvis Enroll yet. It gives you the opportunity to put in data. You can try different scenarios, and you can do everything except submit a live application. The test site replicates Jarvis Enroll through all the different steps and allows you to get that experience and that practice before sitting down with a client. We have paper resources as well. We have our paper application where you can see the underwriting questions ahead of time and get familiar with the types of information we do collect for an underwritten applicant. And in your producer handbook, we have a great FAQ section that answers many of the underwriting questions you may have in terms of what does something mean, how do I know, or how long will it take to process. Our FAQ section is pretty robust to answer many of your questions. And to help you along the way with some of the questions, we do have a medical glossary and a partial drug listing in the appendix of the producer handbook. These will help explain some of the terminology on the application. And from the prescription drug perspective, we list out the most commonly issued prescription drugs that reflect the questions or the medical conditions that we ask on the application. So again, tremendous resources at your fingertips. So as you go through the enrollment process, when you ask the questions, I mentioned it's going to trigger what kind of rate may be applied. In many of our states, we are what we call community rated, but we apply an early enrollment discount for certain individuals who meet the criteria. We do gender rating. That went into effect in January of 2020. And then we do have tobacco rating for individuals who have used tobacco products within the last 12 months. Now, some states have exceptions, and the tobacco rate would not apply during open enrollment or if the consumer is coming in through a guaranteed issue rate. But some states do require us to issue tobacco rates regardless of the situation. And that information is also illustrated for you in your producer handbook under the discounts and eligibility section, the red section. So when you think about community rated, people ask, well, what does that mean? When you think about true community rating, consumers in the same rating class pay the same price. But if you were to think about a Plan G female in Eastern Pennsylvania, a 95-year-old and a 65-year-old having the same price, that would not keep us competitive with what other carriers use in the market. And that's where that enrollment discount can come into play. That helps offset our base rate by providing a discount to consumers who are within a certain time period of their Part B date and coming into the plan either in open enrollment, guaranteed issue, or going through underwriting and not having any of the conditions listed on the application. So it's our preferred rate or our standard rate with enrollment discount, but we do offer a level 2 rate for those individuals who come through underwriting and have some of the medical conditions. If you use Jarvis Enroll, which I highly recommend, it will calculate the rate for you. As you saw on the last slide, we do have area rating in some states. Pennsylvania is one of those states. Basically, we've divided the state into geographic regions and have different pricing levels for the different areas. One thing I do like to highlight is that between UHIC and UHICA, we do have a little bit of a flip-flop on areas out west with Beaver and Indiana counties. So you don't want to just assume, if you're looking at a UHIC map, that if they're in Area 3 in Beaver County, they're going to be in Area 3 for a UHICA plan. A little bit of a crisscross there for whatever reason. But again, Jarvis Enroll will serve up the appropriate rate based on the consumer zip code once you enter in that demographic data. But if you're using the paper materials, you do have zip code tables in both enrollment booklets to ensure that you're applying the appropriate area rate. We talk about our enrollment discount. This is a unique little discount structure that does drive up some questions. Basically, for our UHIC plans, consumers can enjoy up to a maximum 6-year discount if they qualify. So it's available to consumers who are met up open enrollment, have a guaranteed issue right, or go through underwriting, and do not have any conditions that we ask in our underwriting questions. If they come in at age 65, oops, I think my animation's off here. You're not able to see that. Sorry, as I'll grade back. The animation looks like it got unlinked. So starting at age 65, the consumer would be receiving a 39% discount off of the base rate if they are within 10 years of their Part B effective date. Starting at age 69, that discount begins to wear off each year by 3% on their policy anniversary. So that last year of that 16-year duration would be age 80. If they come in at a later age and qualify for the discount, they would just get fewer years of the discount because it would be applied at the age in which they come in. I know it's kind of grayed back there, a little bit hard to see, but we have charts like this in both your handbook and in the enrollment kit. And the enrollment kit is a great tool to use to explain it to your clients. You do want to remind them that it will wear off because they're going to call you and say, oh, I got a second rate increase. The first thing to think about is, did they just have a policy anniversary? It could be the wear off of the discount, especially if they were 69 or older. We also have a discount on our UHICA plans. It's a deeper discount, one of the features of UHICA. Instead of having the wellness extras, we focus more on the discounts that are available. The UHICA discount starts at age 65 and has a duration of 21 years for a consumer that comes in at age 65. If they come in later and qualify for the discount, they could still enjoy the discount, but for fewer years, depending on the age in which they come in. For UHICA, the discount starts at 45% at age 65. At age 68, it begins to wear off 2% each year up until they reach age 80. And starting from age 80 to 85, the discount wears off 3%. So think about that. You could have a client in a UHICA plan, maybe age 80, still receiving part of the enrollment discount on their coverage. When they reach age 86, they would pay the standard rate. Again, they do need to be eligible for the discount by meeting the criteria of being within 15 years of their Part B date and not having any of the conditions if they're going through underwriting or coming into us through a guaranteed acceptance rate. So here's an example of a rate table to show you just how that calculation works. This is a UHIC illustration, and I can tell right off the top of the bat because I can see all the different plans offered that are not part of UHICA, such as plans K and L. So for UHIC, the base rate or the standard rate is the 81 plus rate. So if you were to take that 81 plus rate and reduce it by 39%, that would bring you to the rate you see for a 65-year-old, a 66, 67, and 68-year-old. Starting at age 69, you'll notice that premium's a little bit different because that individual would be receiving a 33% or 36% rate, a discount off of the base rate, and so on down the line. But does it mean the consumer will pay that premium for 4 years? As that 81 plus rate is going to change each year based on any type of rate actions that may be taken in June. What stays the same for those first 4 years is the percent. So whatever our 81 plus rate is changed to in June of this year, that 39% would then apply to the 66-year-old that you just wrote last year as a 65-year-old. Same thing, it works the same way for UHICA as well. Only the percentages are different. Now, it seems like it's a lot to try to figure out, well, how do you know which those rates are, if they're, which rate will apply? This little chart is taken right out of the producer handbook and a great visual illustration of how the rates work together alongside underwriting. So if you think about underwriting within the first 6 months of their Part B, no underwriting. If they're 7 months or more, we're going to use underwriting to determine the rate and eligibility unless they have a guaranteed issue rate. And then that gray area shows you which rates would apply. So going through underwriting, if they pass underwriting, they would get the standard rate with the enrollment discount. If they do have medical conditions that we ask on the application, they likely would be rated to our level 2 rate. For UHIC, if they're 10 or more years past their Part B date and are healthy or have guaranteed issue, they would get our level 1 rate, which is not quite the standard rate with enrollment discount, but certainly not the level 2 tier rate. Okay. And if they do have the conditions, they would get that level 2 rate as well. You do have this visual in your producer handbook to refer back to if you want to kind of step through how underwriting and rating work together. It's a great little tool. And in the UHICA handbook, you will see that that message for the Part B effective date is 15 years, because remember, UHICA has a longer discount setup. So it's a 21-year versus 16. So it's extended 5 more years from the Part B date. Other ways the consumer can save. We talked about the enrollment discounts, and just to highlight, those discounts are already built into the rate tables. But other savings that consumers can have is a multi-insured discount when 2 members in the same household under the same AARP membership number enroll in a med-sub plan with us. Okay, so that multi-insured discount is 7%, is calculated off of that standard rate or that base rate. They can also save more if they pay electronically, $2 per individual per month if they're in a UHIC plan, or $24 if they pay annually at the time the rates are set. So ways to save more. On UHICA, it works very similarly, but the wear off is different. It starts at 45% at age 65, 66, and 67. Wears off 2%, so it's wearing off more slowly, which could drive more competitive premiums than what you'll see in the market, because that discount is eroding more slowly than it does for UHIC. And then it jumps to a 3% wear off from age 80 to 85, returning them to the standard rate or the base rate at 86. Same concept, different percents. And the additional savings can be a little bit different as well. We have a multi-insured discount, 2 insured members, same household, same AARP membership number, 15%. But that 15% is going to be calculated right off of that premium amount you see for their particular age. Okay, so if they're 65 years old, you would calculate that 15% off of the 65-year-old rate for that particular plan. We also have a household discount as a second option. Maybe it's a home where one member or one spouse is not yet eligible for Medicare, and the consumer or that second individual, perhaps a spouse, is an AARP member. The applicant would be eligible for the 10% household discount, meaning there's just the presence of another AARP member in the same household. And then if that second member were to enroll in a med-sub, it would move to the 15% multi-insured discount as long as they're registered under the same AARP membership. EFT savings are a little bit deeper, $4 per member per month, but the annual payer is the same as UHIC, $24 per member annually if they pay their premium in full at the time the rate change goes into effect. Okay. So let's get to enrollments. 2 ways to enroll. You can use Jarvis Enroll. Highly recommend. It's simple. It's a great user experience, and it does all the thinking for you. But we do have paper applications. We know situations may call for an enrollment kit. In particular, in case you didn't know, if you're writing under 65 business, it can only be done on a paper app. Okay, just to call that out. But either way, whatever works for you and your client, we have the resources available for you. When you go into Jarvis Enroll, you have 3 ways to capture the signature. You can do it remotely. And for remotely, you can use Adobe Sign, or you can use Express Security Code. If you're sitting in person with your client, they can sign on a touchpad and do that electronic signature, or they can also do the Express Security Code as well, as long as they have access to their email to retrieve the code. Using Jarvis Enroll, again, the rates will be calculated for you. And it's going to do all the thinking in terms of serving up any questions that are needed, ensuring you don't skip over a question, and really adds a kind of an accelerated or a speedier process for getting that enrollment application in the door. Remember, if you're doing a DVH enrollment, you must use Jarvis Enroll at least for that portion of the application. So where do we go for help? First of all, let's talk about your clients. Once you enroll them, they're going to get a little welcome pack. They'll get a plastic card in the mail. They'll get information about signing up for the member portal. I do encourage you to encourage your clients to register on the portal. It's a great resource for them to access all the information around their plan. They'll periodically receive information from us, whether it's newsletters, healthy tips. They can monitor their claims and so forth. For the first time ever, we have an illustration here of what the member website looks like. We've been working with our marketing team to say, we talk about this member portal, but can we get a graphic to show what it might look like? So maybe your client lost their card. They can go in and download a copy. They can request a new one. You can also do that for them in Book of Business functionality. They can monitor their claims. They can look up their Renew Active local gyms if they're in our UHIC plans. A great resource for members to continue to access information around their plans. So if you can encourage them to enroll, it'll make their experience and probably yours a lot less questions coming in because they have that information on their portal. But for you as an agent, we know how hard it is, or how hard you work, I should say, to bring in your new clients and continue to support them. Our Jarvis tool is really state of the art. We continue to hear amazing feedback around this tool. It is a huge tool. There's a lot of great information out there. Everything from taking your certifications to accessing marketing materials to monitoring your book of business. Let me just highlight a few of the great tools on Jarvis Enroll that you might find helpful. When it comes to servicing your clients, please note that when we have contact with your client, particularly through the enrollment process, if we are sending them a letter, we are posting a copy of that letter in Jarvis as well under the application section to let you know what information is missing. If it's a pending app, maybe we need notes from their physician to evaluate a particular underwriting question. We're sending the member a letter. We're posting a copy of that letter in the file that you can see. That gives you knowledge of what the reason is for the pending. It can also help you better understand what information is needed so you can guide your client. When we put our rates out there and we send your client rate information, you can see that as well. Jarvis Book of Business allows you to manage your client's book. Simple things, perhaps you had a return piece of mail come back as an incorrect address. Check out your Jarvis Book of Business. Maybe they've contacted us with the correct address, but they forgot to notify you. If you want to check on information or do any kind of service request, you can do that through your Book of Business. You can also do it for an application that is in pending status. Maybe we need additional documentation. You can upload a number of different items through our online tool right here in Jarvis Servicing under application status. Maybe you want to adjust the effective date. Maybe they thought they wanted their plan to go into effect 2/1. You sent the app in. Now we want to move it to 3/1. There are tools and resources under the servicing request that you can do at your fingertips. No more having to print out a piece of paper, take it to their house and have them sign it. It can be submitted to them electronically for an electronic signature to keep the process moving and make it a lot simpler for you as the agent. Sales materials portal. Here's where you're going to find certain information such as your enrollment kits, your producer handbooks. You have the ability to download PDFs or you can order printed copies to be sent to you at no cost. As of last week, the enrollment booklets have been updated with the 2025 copays and deductibles. So if you've ordered enrollment kits before last week, you may want to order some new ones that reflect the new copays and deductibles for 2025. There's also some pre-printed materials that you can have, which you might find useful for things like community events. They're not personalized. Those would come from the toolkit, but we do have some bundled pieces out on the materials ordering site as well. Two most popular, can't speak enough about these, the enrollment booklet and the producer handbooks. Okay, these are the images for the current materials that are in play until May 1st effective of 2025. If you don't have handbooks, I encourage you to access them. You would not believe how many of your questions can be answered by the content that you'll find in the book. They're color-coded to help navigate the sections more easily, so that if you're looking for an underwriting question, if you look in the table of contents, you're going to know you're heading to the red section. Amazing resources. Enrollment kits. Sometimes agents say, I don't really need them because I do everything on Jarvis. You will not believe how helpful these are, even to keep a copy on your computer. We have the outlines of coverage that give you the detailed benefits for each of the different plans offered. It's a great education piece to use with clients to help them understand the plans that they're purchasing. All the forms are in there if you want to refer to them. If you want to just preview the underwriting questions, it's easy to read when it's in the booklet format. So another great resource. I keep them on my desktop all the time and refer to them as needed. Toolkits, we're going to find great marketing materials. We have sales presentations, we have mail pieces, we have digital marketing items that you can download and use on your approved social media, and more. In fact, if you are out on the toolkit, you may see a few pieces with a peach-colored banner that say free. That means we will pick up the printing cost if you were to order those pieces. Some of them do require you to purchase the print on your own, but we do have a few featured pieces available. These are the pieces that you can customize with your own contact information and use them for events or leave behinds at events or appointments for your clients to know who you are and who to contact. Learning Lab. Learning Lab is more than just the source we go to complete our certification each year. Learning Lab has an incredible amount of information on all things for United Healthcare. For MedSup, we've got a MedSup overview. We have videos, we have games, we have our DVH tools. You can actually see sample policies out on Learning Lab. A lot of information, and the nice part about that is you can access this information 24/7. So when you have downtime and are looking for information, maybe you were not able to attend a training, it's a great way to look for information that you need. We've got a Jarvis Enroll video. So lots of information out on Learning Lab for you to access on your time. I'm highlighting another I'll call it a new resource that's on Jarvis. This is on under Knowledge Center, so it's on the homepage at Jarvis. And it's called Plans at a Glance. We have a document for the states in the East region and document in the West. These are overview. They're one-pagers that give you summaries of the plans offered in our different states. This is a B2B piece, so it is not filed for you to use in a presentation to your clients. You would go to the presentations on Toolkit for those. But this is a nice little snapshot for you as an agent to just get that overview of the important elements related to that particular state where you're selling, including things like market share, Medicare eligibles, and more. So a new feature we're sharing this year, and the documents are posted right there, Knowledge Center, under reference guides, and then go to the product guide section and scroll down to MedSup. So a nice little feature. We also have our authorized to offer program. So agents who are contracted with United and authorized to offer any of the branded plans are authorized to offer. For MedSup, we do have an elite program for agents who sell 25 or more full commissioned plans in a calendar year, or have an active book of 150 or more MedSup customers. Elite status gives you access to some special promotions, extra cash rewards, a listing on my uhcagent.com, and more. So a great way to help promote your business by becoming an elite agent. There is so much to learn, and we could do workshops for days in and days out. This is an overview of my schedule for the webinars that I host for the different states that I cover. As you can see, I have a 101 session tomorrow, a couple webinars next week, and I've already got my February calendar up there. And I also host 2 chat sessions each month. These are open lines where agents drop in, ask their questions, maybe stay on to hear what other agents are asking, or maybe go about their own way. They're not scripted. There's no presentation. It's all about agent questions. So the chats are a great opportunity too. And Christy, I will send you the link to my landing page, and you feel free to pass that out. You are welcome to join any and all of these sessions coming up. Don't forget our producer help desk is here, available to help you with your questions. This is the place you want to start. Whether you have a question or an issue, open it up with the producer help desk. They will create a service request number that will be tied to that particular issue. If it does need to escalate into the business team, they would then look up that service request number, find out what's already been done so far so they're not replicating actions, and continue on to try to get that issue resolved. But your starting point should be using the producer help desk for any kind of your servicing needs. This is just an overview of our team. As you can see, those teal states are mine. These are my colleagues across the country doing what I do in the different markets. And then our colleague, Rebecca Mest, who works with the National Marketing Alliances nationwide. So some of the uplines to many of the agencies that we work with, Rebecca engages with those. So that's our mean and lean little MedSup team that you see from a national perspective. And that kind of brings me to the end. I know I covered quite a bit of information, but I'm happy to take any questions or review anything that maybe I went over too quickly.
Thank you so much, Claire. You did a phenomenal job, as always. Very detailed, exactly what I was looking for today. I don't see any questions out here, so great job. And I will hand out those links that you talked about during your presentation. And if anybody has any questions, I'll put them in touch with you if I can't answer them myself.
Fantastic. And Christy, I can't thank you enough for this opportunity. Thank you for giving us the time with your team to go over this information. We appreciate your partnership. We appreciate all that all of you do to offer ARP MedSup plans to your clients, and look forward to working together in 2025.
Yes, likewise. Have a great rest of your day and stay warm, everyone.
Thank you.
Bye-bye.